Hi, I'm Dr. Puneet Kochhar. I'm a fertility specialist at Elixir Fertility Center in North Delhi. Today, I'll be talking to you about the importance of lifestyle changes in addressing fertility issues in both men and women. The first parameter that we'll be addressing today is age. Now, the age of a man doesn't really matter much. So, a lot of people today are delaying getting married and planning a baby beyond the age of 35 and 40. If you're talking about the man, the sperm parameters won't be declining as rapidly as the egg parameters in the case of a woman. So a man's fertility probably is going to be the same at the age of 40 or 50, whereas a female fertility starts declining much rapidly starting in the mid-30s. So at the age of 37, this decline becomes a lot more rapid and even more rapid after the age of 40. If you're talking about having an IVF cycle with your own eggs, the chances of conceiving below the age of 37 are about 45 to 50%. Between the age of 37 to 40, the chances decline to 30%. And after the age of 40, the chances are only about 10%, even in good cases. So the earlier we start planning a pregnancy, the better it is. पुराने ज़माने में होता था ना 20s में बच्चा हो जाना चाहिए. Ideally, that is the right thing to do. But we are all career oriented. I myself got married after 30. So kids are mostly planned when we are in mid 30s. At least do not delay it to late 30s and early 40s. So the first thing that I would advise is start planning your pregnancy, if not in your late 20s, then in your early 30s. The next issue that I'm going to address is diet. So a lot of us are working today and we are living on junk food, we are living on fast food, which is not a healthy way of living. We need our 5 portions of fruits and vegetables because they give us very essential vitamins and minerals and antioxidants जो हमारे fertility potential को भी ठीक रखते हैं. ऐसा नहीं है कि इन चीज़ों से हमारे सिर्फ कार्डियक सिस्टम को हेल्प मिलेगी, हमारे मेटाबॉलिक सिस्टम को हेल्प मिलेगी, हमें प्रेगनेंसी प्लान करने में भी हेल्प होगी बिकॉज दीज आर गोइंग टू इम्प्रूव योर स्पर्म पैरामीटर्स, योर एग पैरामीटर्स एंड इवन इम्प्लांटेशन इश्यूज. सो डाइट इज वेरी इंपॉर्टेंट. The third thing is your weight. A lot of people these days have a sedentary lifestyle. So बहुत लोग एक्सरसाइज नहीं करते, रेगुलर वर्कआउट नहीं करते. पीसीओ एक कॉमन बीमारी है जिसकी वजह से लोगों में वेट बढ़ता जा रहा है, या उल्टा भी कह सकते हैं वेट बढ़ने की वजह से पीसीओ ज़्यादा मैनिफेस्ट कर रहा है. बट द पॉइंट इज दैट इंक्रीज वेट इन बोथ men and women is causing problems in conceiving. It is decreasing your potential to get pregnant within a certified amount of time, and it is also going to increase your requirement for medicines. जितना वजन ज़्यादा होगा उतना आपको कंसीव करने में दिक्कत आएगी, उतना आपको दवाइयों की ज़रूरत ज़्यादा पड़ेगी. The easiest way to cut down weight or to decrease weight is to start regular exercises and go on a healthy diet plan. Don't go on a crash diet. Don't look for bariatric surgery as a first resort. So that is the third thing, your diet, which is very important. Then obviously environmental things like exposure to smoking, alcohol, other drugs, excess of coffee and tea. When I say excess, usually we say 2 to 3 cups at the most is okay. Book definition of excess is more than 8 cups of coffee, but don't try to get to that level. So more than 3 is excess. So let's talk about smoking. Smoking for both men and women should be a practical zero. So if possible, quit smoking. If you're not able to quit smoking, start reducing. It won't happen overnight. I have had patients, I can't name them of course, if you're watching this I'm talking about you. I've had patients who within a span of 3 months went from a sperm parameter of 2 million to 22 million by completely stopping smoking and cutting down on alcohol, and hats off to those patients. So ऐसा नहीं है कि smoking छोड़ना मुश्किल होता है. आप थोड़ी सी कोशिश करेंगे, probably थोड़ी ज़्यादा कोशिश करेंगे तो हो पाएगा. And of course we are there to help you with this. Then alcohol. So the normal allowance for a male for alcohol is up to 2 to 3 times a week and up to 3 units on one particular occasion. So 2 to 3 units on one occasion. For the female, it is maximum once in a week and maximum 1 unit on an occasion. So it is not that you can't completely have alcohol. You can have alcohol in moderation and no binging. So on one particular occasion, you should not be going for more than three drinks. So that is the next thing that we had to discuss today. So the next thing, which is probably the last thing that I'm going to discuss, but it is not less important, is stress. stress in both men and women, and stress which is both mental or physical. So a lot of people think that we are living our lives absolutely lavishly और हमें कोई stress नहीं है. But then you have this constant nagging something in your head. आज मेरा ये छूट गया, आज घर वालों ने ये बोल दिया, आज सोसाइटी ने ये बोल दिया, या even a mild stress like आज मेरी साइकिल का ये डे है, आज 14 डे, आज कॉन्टैक्ट रखना है, आज कंसीव करना है. ये स्ट्रेस आपको कंसीव नहीं करने देगा. So you should be completely stress-free mentally as far as possible. Again, a lot of us have very difficult job profiles and stress comes as a part of it. See, it is up to you to improve upon it. If you want, talk to your family, talk to your friends. If you want, listen to some music, do something that makes you feel good. Do regular exercises like breathing techniques or pranayam. Follow a de-stressful schedule. And if you really need help, then look for help. But try to avoid stress. It is going to help you conceive naturally, and it is also going to improve your IVF success rates. Thank you.